Good evening, I'm Carla Eccles, Director of Cultural Diversity News and Engagement at KMEW. I also host a music show called Soul Stations. We welcome you tonight to our virtual town hall meeting called Facts, Not Fear. And we also welcome our viewers on the Roland Martin Unfiltered streaming live on all platforms, including YouTube. We are so glad you have joined us tonight. You will be so glad as well. With COVID-29 cases and hospitalizations rapidly surging in Sedgwick County in Kansas and across the nation, the Wichita-Sedgwick County African American Council of Elders and the Wichita Black Alliance have launched Facts, Not Fear, an outreach and education campaign to inform the community about the necessity to follow the recommended health guidelines to protect their families from contracting the coronavirus and to encourage individuals to make lifestyle changes to help mitigate the spread of the disease. Also, Kansas is one of the nation's highest COVID-19 positivity rates at 34%, and African Americans are already dying at a rate of more than 2.5 times of other ethnic groups in the state. Again, we have an excellent panel tonight who are going to share their expertise regarding what we are facing and what we should be doing during this pandemic. And I would like for them to briefly introduce themselves. We are going to start with you, Dr. Duggins.
Hi, I'm Dr. Duggins. I'm a family medicine physician at Ascension Via Christi. I'm a faculty member there, teach residents. I've been doing that for the last 18 years. And I'm also an associate professor at KU Medical Center. And it's nice to be here.
We're glad that you've joined us, Dr. Duggins. Thank you so much. Veronica Henderson, if you would introduce yourself. You're on mute.
Hi, my name is Veronica Henderson. I'm a registered nurse at Wesley Medical Center. I've done that for 8 years, and I've also recently finished up my nurse practitioner in psychiatry.
Thank you so much, Veronica. Councilman Johnson, if you would introduce yourself.
Good evening, everyone. I'm Brandon Johnson. I represent District 1 on the Wichita City Council. I've been in this role since 2018 and looking forward to the discussion tonight.
Absolutely. Karen Wright.
Good evening, Karen Wright, Assistant Director and Academic Advisor in TRIO Student Support Services at Wichita State University, and I've been serving there for about 5 years. I'm happy to be here.
Thank you, Karen. If you
You're
would
welcome.
introduce yourself, Chandrika Towns, who goes by Dee. Hi, Dee.
Hi, I'm Chandrika Towns. I'm a master's level social worker. I work in mental health at Sound Mind Mental Health Association. I've been doing this since about 2013.
Thank you so much, Dee. DJ Fisher, if you would introduce yourself.
DJ Fisher, sports agent, businessman, philanthropist, originally from Wichita, Kansas, living in New York City.
And DJ, we want to start with you and Brandon on this topic of COVID. And I tell you, I've been hearing so many different things. And I understand that you both have actually contracted COVID and you've said so publicly. What was your experience, DJ, and how has been your recovery?
My experience was pretty surreal. I thought I was young and strong, returned back home to Wichita in early spring. As I was leaving Wichita to return back to where I live and reside, I started feeling symptoms and became unbearable. I think the most intense moment is probably overheating and not really having control of myself, but the recovery was a blessing. I can see how people pass away from it and can definitely, lose control mentally as well as physically.
Did you say overheating? You felt, what did you say?
Yes, ma'am. Overheating, sweating like no other, constantly keeping myself hydrated.
So those were part of your symptoms. And how did that recovery come about? How long did it take you to recover?
It seemed like it was 12 years. But reality, probably 5, 7 days. Lots of lemons, lots of oranges, water, obviously. But yeah, to say the least, I feel like it was a miracle that I came out of it.
Wow, that's really poignant. Thank you for sharing your story, DJ. And we want to ask you the same question, Councilman Johnson, about your experience with COVID and also about your recovery.
Yeah, so my experience, I was blessed to have a mild experience, but even then, you could tell how serious that this was. The symptoms came on quick. I'd say within 3 hours of my cough, I had a 103-degree fever. That fever stayed between 100 and 103 for 4 days, even with taking medicine. So, the medicine didn't get me below that. I was tired. I noticed now I can tell I could not focus back then. I wanted to keep doing emails and responding to my constituents, but I just couldn't focus on that. Was tired all the time. I didn't have all the achy muscles, but it was just a serious impact. And then about day 4, I lost my sense of taste and smell. And I was greatly disappointed. My wife had made some wonderful looking pork chops, but it just tasted like, whatever, just something in my mouth. But that was a pretty bad symptom. And then that went away maybe 2 or 3 days ago, or 4 days ago now. Just recovered. So I started my symptoms on November 5th and just got out of my recovery. So it was mostly mild. I did feel some tightness in my chest. So I think if I wasn't a former athlete and I wasn't in some type of decent shape, that really could have been pretty bad for me.
And Brandon, I'm curious because a number of people, they're really reluctant to tell others that they have COVID. What made you decide to share?
It was the responsible thing to do. I'm around a lot of people, even during this time when I try to stay mostly at home. I was just in Lawrence for a young man who has been imprisoned and shouldn't be, went to a rally there, came back. There was going to be a protest that weekend on a title loan place in our district, and we don't need those types of businesses. And having that cough, I wanted to make sure, one, I wasn't exposing my family to COVID. And then 2, people that I might be around, even with the mask, I wanted to make sure I knew for sure whether I had it or not. And luckily here in Wichita, we're starting to have saliva testing options, which can give you results within 12 hours. So found out I had it, went ahead and immediately continued my isolation away from my family and didn't attend any events. And the responsible thing for me to do then was also let my colleagues on the council know and anybody I've been in contact with. So contact tracing for me was very easy because I was already doing it, as well as giving health professionals that information. But in this day and age, you want to make sure you let everybody know as soon as possible so you don't spread this to someone who may not be as blessed and fortunate as I am.
And what kind of test did you have? Did you have the saliva test? Or?
Yeah, we took a saliva test. Here in Wichita, again, Wichita State has been able to acquire some equipment to do saliva testing. And as they're rolling that out for local businesses and soon the general public at various collection sites here in the city, that's where I went to get my test. We needed to make sure we knew pretty quickly. And again, especially with me being in government, I could expose so many people. So we shut down our whole council office for 14 days because of that potential exposure.
Thank you so much, Councilman Johnson. As we turn to question 2, we want to talk to our healthcare providers, and that is Dr. Duggins and Veronica Henderson. We'll start with you, Dr. Duggins. And the question that we have for you at this time is we want to ask you what you all have been seeing, because this is so serious. I see you're on with us, Veronica, and I know Dr. Duggins will join us in just a moment. But, as healthcare providers, and I'll start with you, Veronica, what have you seen and what has been your experiences with this pandemic?
Well, we've seen an array of symptoms naturally because I work in acute care. So we have seen some mild symptoms come in, people not being able to maintain their temperature, as Brandon stated earlier, being very hot or having a high fever, 103, 104, and not being able to break it. And we've also experienced patients where we've had to intubate them. And intubation is where they place a tube down your throat and it allows for you to breathe, in essence, to get good oxygen exchange. And that is the most severe case. And in the cases that we experience in Kansas, and getting you off of that ventilator, getting you off of that breathing tube is very difficult.
And you see people are really isolated, would you say? How's that going in terms of the patients themselves?
Isolation is a huge thing because humans are very social. So, from my experience being at the bedside, I think that's half of the battle. Being away from family, being very scared, having to trust people that you don't know. Although healthcare providers are doing their best, we FaceTime often. We use this Marco Polo app to help families and patients feel connected, but it is isolating on top of being very ill.
And some people are passing away from this disease, we know.
Yes, yes, yes. We run codes, physicians, nurses, RT. They have really showed up in this season as far as uniting and everyone doing their fair share. Nurses have been doing their due diligence and just jumping right in, trying to support our communities to make sure that people's loved ones are getting home safely and that they can enjoy the holidays. So we kind of mentioned responsibility. So I think it's really important for us to share the information that we know and share our realities, because there's been a lot of miscommunication for many platforms, whether it be politically, whether it be healthcare, and what's real and what's not real. And the reality is that COVID is very real. And if you have diabetes, if you have respiratory issues, even something as what seems as minimal as asthma, COVID can really be disruptive to that person, and in severe cases cost them their lives, and in less so severe cases, just be hospitalized or stay with your family, et cetera. But one thing we don't know is the long-term effects of COVID. So although it may be very minimal in 2020, we don't know 20 years from now, will you need an inhaler? Will you need oxygen? And we also have to take that into consideration, especially for our youth. We don't think it affects children that much, but it's still such a novice virus. We can't discount it, and we all need to do our fair share and wear our mask and wash our hands and social distance.
Thank you, Veronica. Dr. Maurice Duggins, what has been your experience? What are you seeing?
We've been taking care of lots of folks, both from our local community as well as surrounding communities, as Veronica says, and they're on the front line more so than we are, because we come in, we spend a little time with the patients. They as nurses spend a whole lot more time with these patients than we do. And we write orders, we assess them, and then we move on. And then we have to sometimes speak to the families as well, but most of the time they're on the front line compared to us. But it's been amazing to have to deal with patients with COVID that are 11-month-old and others that are 80 years old. Of course, the ones who tend to die the most are those who are older. So those are above 60 or higher risk. And we know they tend to succumb much easier than the younger patients. However, that does not mean I haven't taken care of patients who are much younger, in their 20s and 30s, who have died from this disease. And therefore, we really strongly recommend that people follow the recommendations, as Veronica just went through, of washing your hands and wearing a face mask and keeping your social distance. I've been encouraging folks to also make sure they get their flu shot just ahead of time, so you don't end up with the flu and then also get COVID on top of that, because that would be a double whammy. And if you at this point don't have COVID and you have an exercise routine, you might want to just continue that, just to stay as healthy as you can, keep your immune system as strong as you can.
I'm glad you shared that, because I know people are wondering, what can I do? How do I, not get this disease? And then I'm curious too, are you finding a lot of people are calling or trying to, do I have it? Are they coming in, trying to get, are they asking about testing?
Yeah, there are lots of people who have questions about whether or not they have it. I have 3 children, adult children, and every 2 weeks, I think I get a call from one of them asking, is this it? Because there's so many variations that you hear. The most common things that we tend to find is the fever. Some people then have fatigue. Others then get shortness of breath or coughing. But as Councilman mentioned, the loss of taste, that's another pathognomonic sign that if you have that, we know that you have COVID. Testing can be very difficult according to where you live. Even in Wichita, there are days where you have to have symptoms in order to get tested, or you have to find the right location where you can get tested, and that location may not be covered by your insurance. So we struggle with this. The best way to find out where you can get tested, look around, search on the internet. Many of the pharmacies now are offering tests. You don't go to the hospital to get tested. If you're at the hospital, you're probably in a severe case and you will be tested. So if you're concerned about whether or not you have it, wear a mask, and you can usually find one of their agencies, the health department or one of the pharmacies around here that can get you tested. There's some urgent cares like the Ascension Urgent Care in Murdoch that also does testing for people who have symptoms.
Thank you, Dr. Duggins. In fact, you mentioned a mask, and we're going to watch a video now that talks about the importance of wearing a mask and taking precautions. Here's a brief CDC video to illustrate that point.
I wear a mask because I care about the health and well-being of those around me.
I wear a mask because I might not know that I'm sick.
Yo uso una máscara para mi familia y la comunidad.
I wear a mask because I want to keep others safe.
I wear a mask because I want to protect everybody.
I wear a mask because too many people who look like me are getting sick and dying from COVID-19.
I've grown fond of seeing people smile with their eyes. It's a beautiful experience in these times.
Do it for their futures.
Even if you don't have to, I hope you choose to.
I wear a mask because I really want to get a haircut soon.
Well, as you see, it's so important to wear a mask. And it's been interesting as a reporter how some people still are reluctant to wear a mask. One person said, in essence, you're not the boss of me. She wasn't talking to me personally. She was just saying that she just didn't feel that it was important. But as you can just see how it saves lives and we are protecting each other when we wear masks. So it's just interesting as we move forward under mask mandates and all of that, the importance of wearing a mask during these times. And we're going to talk now to Dee, who is Chandrika Towns, who's a social worker, as she said earlier. And we want to ask you some questions about what you've seen and what has been your experiences with this pandemic, Dee.
Well, I've seen quite a bit. I work with people more on the mental health aspect. I'm a therapist. So I work with kids who have missed school, who are struggling in school, parents who don't know what to do. Everybody's kind of at a loss. They don't know how to handle just the day-to-day because everything is so different. I also work with nursing home patients who are disconnected from their families, who are being impacted by this virus exponentially. I have several clients who are now living in cluster situations. So they are not able to leave their rooms. They're not able to leave their apartments. They are basically cut off from society. They don't have cell phones. They don't have tablets. They don't have any type of communication in their rooms. Before the numbers went up, they were able to have window visits where the families come to the nursing homes and sit by a window. It's not the same. So I deal with a lot of depression, a lot of anxiety, a lot of fear, isolation, which is different than social distancing and staying home. It's more, I'm stuck in this place and I don't have a choice. So being able to work with these clients and patients on a mental health aspect in regards to how to take care of themselves, how to, manage their day-to-day when literally they're sitting in their rooms or their apartments and they can contract COVID because it came into the facility. That is my biggest clientele, my biggest population, just getting our elderly community and their families to recognize how impactful and how dangerous and how real this virus is. understanding that when it first came out, we didn't know. Now we do know, and making educated decisions to wear a mask, to social distance, to delay that instant gratification of hanging out with your friends or hanging out with your loved ones for the holidays, just to keep mom safe or grandpa safe. We also see generations in homes where I had families who moved grandparents and moms into their houses so that they could, be connected, so that they could figure it out together while being apart. And we have grandparents, we have the middle generation, and then we have a younger generation, these kids that are in high school or middle school, and then we have college students who are coming home. So we have multi-generations trying to figure out how to get along, how to keep each other safe. And sometimes they clash, sometimes they don't get along. So my biggest thing is making sure that they're being mindful of one another and working together as a family unit, making sure that everybody is connected and finding different ways to do that, making phone calls, sending cards, writing letters, kind of getting back into that old way of communicating. So that's
what I wanted to ask you about, what kind of tips you would give. What do we need to do during this time to really stay sane? And because, when you look sometimes even with the media and, so many reports about COVID, we're hearing all these different things and, we want to get your take on what can we do to try to, tap down the anxiety that we may feel?
Some of the things that I've been recommending is making sure you're taking care of your body, making sure you're eating right, exercising, getting sleep, making sure that you unplug. Don't spend 8 hours staring at social media or the news, or just limit your intake of all of those things that can be negative and overwhelming. Connect with people in other ways, like we said, phone calls, Zoom, letters. Continue to positively speak to yourself, speak life into yourself, speak life into your family members, understanding that this is difficult for everybody. No one wants to be the party pooper or say no to things that they want to enjoy, but creating new traditions, put your heads together, see what you can come up with, have fun. There's so many things on the internet. There's trivia games that you can play in different households. There's all kinds of stuff.
That's really good examples. Thank you so much, Dee. We really appreciate it. And then we're going to turn to Karen Wright to talk about some things as it relates to young people. And Karen, I know you work at Wichita State and have for a few years. And I understand that you have expressed some frustration with regard to how young people have disregarded this pandemic via social media. What are your thoughts and why are you so frustrated, Karen?
Oh my gosh, I am frustrated because I believe and I see that there are so many organizations in the Wichita community and individuals in the Wichita community that are really trying to get the message out to everyone, to every age group, to every sector, every neighborhood, so to speak. But I find that my 18-year-olds, I call them my 18-year-olds because I work with students at Wichita State, and I also have some younger individuals in my family, but the 18-year-olds to 30-somethings, for whatever reason, I don't know why they're not taking this pandemic seriously. We are messaging, we are communicating, and I ask myself, what is it that we're missing, that we're not connecting with the 18 to 30-somethings, 35, even almost 40 years old. And I find that even on campus, for example, we're walking around and if you are walking by yourself on campus, it isn't a requirement that you wear a mask. But if you are in my hallway and if you are sitting at desk in my hallway, you are not social distancing and you are not wearing a mask, know full well I'm going to ask you to put on your mask. And students are diligent, they will, but I shouldn't have to ask. I shouldn't have to ask. And so therefore, the mindset is, well, if COVID is real, and it's that one word, if COVID is real, I probably won't get it because I'm not 65 or above. If COVID is real, and if I do get it, I'll probably have a mild case. But if you believe that COVID is not real, and if you are a carrier and not know it, and then you go and visit your mom, or your grandmom, or your aunt, or your great aunt, and you're a carrier and you do not know it, you could be passing that along to your loved ones. So I don't understand the baby showers. I don't understand the birthday celebrations. I don't understand the large groups of people, even at concerts at a local venue. I don't understand the complacency, and it's frustrating.
Yes, Karen, it's interesting that you mentioned, how young people may look at older people and say, well, they're going to get it. I've been told that, well, I know, I'm in good shape, right?
Right.
I feel good. I'm not going to get the disease. And so what do you think is the message? How can we really get that across to young people that this is serious?
I asked myself that same question, and I don't know what that answer is, but from talking with my students and even my own family members, it took someone within this age group in my own family to test positive for COVID, for some of my other family members to realize, okay, I guess this is real. But we shouldn't get to that point where our students, 18, 19, 20-year-olds, and our family members within that same age group contract the disease, and then and only then does it become real for them. It shouldn't get to that point. So I don't know what the answer is. I hope that once their friend or their family member, if by chance that friend or family member contracts COVID and gets a positive diagnosis, that they are taking it much more seriously afterwards, and they will take steps to safeguard themselves, to exercise, to social distance, to wear a mask. And we're not saying stay in a hut and not interact at all, but we are saying exercise some of those precautionary measures like social distancing, wearing a mask, small groups, not large groups, not partying, not anniversaries, not birthday celebrations, small groups. And think of that other person. Think of your family member who's a little bit older.
And are you finding, with you being on a campus, are students going home and saying they're just going to try to protect themselves on the plane? And are you hearing any stories about people trying to be safe as they go home?
It is so interesting. Some of my students have said, oh, my mom told me I couldn't come home and I can't stay here on campus. So I guess I have to get an apartment with my friend. And then my question becomes, so how many of you are going to be in this apartment together with your friends? But I've heard the whole gamut. Mom says, oh, no, you can't come. It's interesting. I remember after the shutdown for the state, I remember my oldest son went to go visit my husband's aunt, and she's older. She's in her 70s. And there was no longer the shutdown, but he says, I haven't seen Aunt Martha in a while. Let me just go and see how she's doing. So he rings the doorbell and she says, well, hi, baby, how are you? As she opens the door, and he says, hey, Aunt Martha, I just came to see how you're doing. She says, I'm doing fine, baby, but I can't let you in. She said, no. I'm 65 and above, as you so often remind me, but I can't let you in, but I'm doing fine. You come back in a few months when COVID is over. But he hasn't been back, of course, but she was serious. She said, I cannot let you in.
Mm-hmm. People trying to stay safe. I have
yes.
in Colorado. She says when she visits her mother, she comes to Wichita, she just kind of waves from the porch. She won't even go in the house, or, she's just trying to stay safe in these times. And
stay safe,
safe, right? Our loved ones safe. So
yeah.
Mm-hmm. Thank you so much, Karen.
You're welcome.
You so much. As we continue on, we want to bring back Dr. Duggins and Veronica Henderson again to ask them some more questions as health providers. And this question, we'll start with you, Dr. Duggins. To put things in context as healthcare providers, please tell us just how serious this pandemic is and what are the short-term and long-term effects on those who are being infected. So if we'll start with you, Dr. Duggins, your comments.
Well, as mentioned earlier, COVID-19 actually is affecting the African-American race 2 to 3 times the rate that it's affecting Caucasians. And they're the majority race in the United States. So that's why we're making that comparison. We're only about just over 12%. I think it's 12.7 or something like that, percent of the population. So we're under 13% of the population, and it's affecting us in such a significant way that 2 to 3 times the amount of us will die from it compared to the rate that's the folks dying in the Caucasian community. So it's important for us to be very cognizant about it. When you get COVID-19, as was discussed earlier, we have no idea who's going to have a mild case versus who's going to have a significantly devastating case. So everyone needs to be careful. And yes, you may be young and strong, but it may not affect you the way you think it's going to affect you. It may not be a mild case. And even if you have a mild case, you may, again, expose someone in your family who can succumb to COVID-19. And that's not a good feeling or a good place to be. The long-term effects, we still don't know. Some people are describing what we call long hauler syndrome. And that's the scenario where after they've recovered from COVID-19, they may still have pulmonary issues, still having problems with breathing. They can't work out as long as they used to work out. They can't run as long as they used to run or bike, or et cetera. They need more sleep. And it may be months after this has happened. We have a few people who basically have developed what looks like chronic fatigue syndrome because they've had COVID-19. You don't know exactly what's going to happen to you after you've had COVID-19. So again, the best thing is to avoid it until at least we can have some vaccinations to get over it.
That was my question next. I wanted to ask you, a lady stopped me in Dillon's today and she said, Carla, I don't know about a vaccine. She says, I remember Tuskegee, all the things. She said, I'm not feeling the having. What do you think? I would love to get your take on vaccines, what we should think about.
Yeah, there are about 5 to 6 vaccines coming down the pike. The ones that are already currently showing good data, there are about 4 of them. The first 3, Moderna, AstraZeneca, and the third one I'm forgetting. I want to say it's Pfizer. Pfizer is the third one.
Okay.
They have about 90% efficacy rate or above. And we have spent enough time going through and looking at data that says this thing is safe. It's based on what's been done before. Moderna and Pfizer has something that's a little bit new, but it's been tested at least on other vaccines, but not for the novel coronavirus. It used messenger RNA technology versus using what we've commonly used for the flu, which is you take a piece of the virus and then you make an antibody against it. And then some people will then get that piece of the virus and your body will make the antibody against the virus to prevent it from becoming a full infection. Well, the latest one now from Pfizer is currently, and they have a partner in England called Oxford, is currently more like similar to the flu, where they have a piece of the virus and they've developed the vaccine based on that platform. And that has been shown that it's about 90%. It doesn't have to be stored at a very low temperature like the other 2 vaccines. And so it's most likely going to be distributed around the world when it gets permission to be used. They're actually studying it right now in Wichita. And you can look at the newspaper, you can look at kansas.com and research that and just look for the Pfizer/Oxford clinical trial, and you can find ways that you can participate. The more of us as African Americans that participate, the more data we'll have to show that, yes, African Americans also respond appropriately to this vaccine without having side effects that are not seen in Caucasians. Our system are biologically the same, so we really shouldn't have any different reaction than our Caucasian counterparts. And there'll be a location, they'll be recruiting people at Hunter Health Clinic at least next week. I think December 1st to the 4th.
So we need to be looking for that. I'm just curious because that's the one thing that I've heard more than anything else. How do we know that the vaccine will be safe? That's been the question.
Yeah, the big thing that I can say that the FDA has done is that they've pushed their recommendation up in terms of making sure that there's a greater swath of people that are being evaluated with the vaccines because they're having to move so fast to get it out. So maybe it would have taken 6 months to a year to get 30,000 people. Now, because everyone wants to know, hey, can I get protected? So many people have signed up and volunteered to get it. Many physicians have signed on to get the vaccine, get into the vaccine trial, so they themselves can let others know, hey, this is okay to do. Yeah, you may feel a little soreness where you get the injection, but for most people, that's all.
Thank you, Dr. Duggins. And Veronica, I want to ask you again the same question in terms of what some of the short-term effects are and the long-term effects in terms of COVID, what we need to be mindful of as we move forward. Veronica, I was talking to someone who's a singer who is tested positive for COVID-19, and she's having a difficult time still, and it's been I think it's been about a month or two. She contracted it in August, but not able to completely sing now. I just want to get your take on that, get her voice fully, back.
As Dr. Duggins has stated previously, he has more of a outpatient experience working at Wesley. It's very acute. I only see patients for a week or two, depending on how long they're in the hospital. But it's very deconditioning to the body, to the lungs, to the muscles. So you will have those long-term effects for a while as far as feeling weak. Keeping your hands washed, doing daily exercise, even if it's just walking for 5 or 10 minutes, and then having a goal each week where I will, increase my walking by 2 minutes or 3 minutes, or even one thing that we really do give patients at the hospital is an incentive spirometer. And it just kind of helps you inflate your lungs to the maximum ability. And if you do that 10 times an hour, that'll help with some of that air exchange, and just eating and drinking.
And isn't there something that I know you can wear on your fingers that at home that you should do in terms of oxygen and trying to build your oxygen if you test positive? Is that accurate? Is that true?
Like a pulse ox where you could see where your O2 stat is.
Yes.
You could always do that. You want it above 90. And if you notice that it's a little low, you can take nice big deep breaths. If it trends, continuously trends, then I would recommend that you go and talk to your provider.
Veronica, what about people who are at home and they have a loved one in the hospital and they cannot see them, cannot talk to them? What is the best way for them to be able to communicate to their healthcare provider? I'm just saying, I know that there are people that are just really missing their loved ones and they just can't see them at this time. If you would just expand on that.
In the hospital, one thing that nursing is being diligent about is accepting phone calls. I know that we're all really busy, but we do etch time out and we'll go back in. We have iPhones, we'll FaceTime them, and then we'll also do Marco Polo. Families can also drop off a loved one's belongings, phones, things that are sentimental, and just having them at the top of their mind so that they feel supported and loved, because you can feel so isolated. Same thing for families that are isolated outside of the hospital. You can drop food off, you can drop cards off, you can drop chocolate off, their favorite things. Just developing a sense of community. We need that right now with the pandemic and everything that's going on.
Veronica Henderson, how do you deal with the fatigue? How are you dealing with this during this time?
I journal a ton. I'm actually working on a business to help support nurses as we speak. It's called The Nurse Space. As I stated previously, I have a master's degree in mental health. And during my master's program, I formulated a therapy session really targeting nurses dealing with COVID. They are exhausted. They are really exhausted. We need a safe place to go. And I want to help provide that for nursing staff as we are the backbone for our communities right now.
Wow. And what is it called again?
It's called The Nurse Space.
The Nurse Space. Well, thank you, Veronica Henderson. I appreciate your comments. And we're going to now go a little bit further with this. And we're going to ask our panelists to make other comments before. I think we have a video coming up, but first we're going to get our panelists to provide answers in terms of this pandemic. And we're going to start with Councilman Johnson. For those in our community, as well as for those who may be viewing this town hall in other parts of the nation, as we go into this holiday season, what should we all be doing now as individuals as well as in the community, Councilman Johnson?
Well, hopefully we've all, worn our mask and got our grocery shopping done. But, outside of that, I hope we all take it serious enough to get creative this year and understand that this is a year of sacrifice, and it's something that sucks. I hate it. Personally, I haven't seen my grandparents in person, but a few times this year, mostly before March. Since March, I dropped off a plate one day when I barbecued, and that was at a distance. I couldn't go in. I didn't want to risk that transmission. So my hope is that we get creative. Maybe we can't hug, but we can FaceTime. If our family members know how to use technology, let's do that. If not, let's find a way to keep our hands washed, clean, make a plate, and maybe go exchange plates. So if you want grandma's ham and potato salad, you call over there, have her make it, and tell her, sit the plate out on the porch. I'll come get yours and I'll leave you one. But let's try to not bring everybody together this year. And again, think about it. It's a global pandemic. It's a once in a generation pandemic. And if we can do our part this year, we can keep our loved ones going forward. I've had so many constituents reach out to me about losing a loved one or, someone who may not have thought this was serious and they thought they were recovering. And then within a few hours, they're dead. I don't want to see anyone's family go through that. And my hope, again, is that we get creative, use technology this year, FaceTime while you're eating, have that conversation with your loved ones. And then for my young folks, we normally get together and we eat Thanksgiving, Christmas, Kwanzaa, and then we go hang out with our friends and we might go out. Let's not do that this year. Keep that to phone calls, FaceTime. And again, it's a sacrifice that we make, and it sucks. I know we're all tired of it, but again, it's for the greater good. If you truly love your family, if you truly love your friends, then you won't come together. You'll just do everything virtual. You'll cook your meals. You'll take your pictures. You'll put them online. But again, the goal this year is not to come together. We don't want to contribute to the spread, and especially us Black folks, because we are more likely to have the more serious effects of this disease. And so that's my message. I'm going to keep saying it. I hope we all take that serious. Again, use the technology that we've been blessed with. And if we don't have it, exchange those plates and notes, drop a letter in the mail. Do something different than bringing people together. It's just much too dangerous right now.
Thank you, Councilman Johnson. We're going to turn now to Dr. Duggins with the same question. We're going to ask all of our panelists the same question in regard to what we need to be in mind of as we move forward in terms of this holiday season. I want to specifically ask you too about going in the grocery stores. Would you suggest some of the seniors go? I think there's times where they can go early or different, stagger the times when they actually do their shopping, those kinds of things.
Yeah, I think some of our local grocery stores have allowed many of the elderly patients to come in earlier to avoid the crowds.
Yes.
But regardless of what time they go or we go, we should all be masked up, because that's the number one way of reducing this aerosolization of the virus amongst each other. We don't want to be, as people say, swapping air by breathing without a mask on. When I wear a mask, I'm protecting you. And when you're wearing a mask, you're protecting me. When I'm wearing a mask, I'm also protecting myself from anyone else who might potentially not be wearing a mask. So it's both and. So we both need to be wearing masks. All of us should be wearing masks when we go out to the grocery store, any place else that we go in public.
Over our noses, right? Over our noses, and
make sure your nose and not just your mouth is covered when you're wearing a mask. It's ineffective if your nose is uncovered. That's a good point. We need to, it's odd, but a lot of folks don't understand that, and they don't see that or even notice it when their mask is under their chin or just over their mouths. It should be over your nose as well. Both of these need to be covered at all times. If you're wearing glasses, that's awesome. But if you don't always have to wear goggles. But if you know you're going to be in a crowd where there's going to be a lot of yelling, you better wear something to cover your eyes, because that also will reduce the spread to your potentially get into your eyes. So when Johnson just mentioned earlier about not eating together, one of the sentinel things happened this year. My dad is turning 100 years old, and we were planning big. 100, that's a big time thing.
Yes.
And with COVID-19, we had to say, no, this is not going to happen. We want our dad, he's made it to 100. Let's see if he can make it to 101, or at least 100 and a half. And maybe by that time, we'll all have a vaccine and we can enjoy the celebration without putting his life at risk. So make the sacrifice. When you go out, wear a mask. And I always say, if you can, also carry a hand sanitizer with you, because you don't know what you may be touching.
Yes.
And whenever you're leaving the store, wash your hands. When you get into your car, wash your hands. Do that at all the times, just to help reduce the potential of a spread, because occasionally we touch something and then we touch our face without even thinking about it. So have a small hand sanitizer with you as much as you can as well.
Thank you, Dr. Duggins. I'm going to turn now to Veronica Henderson, and the same question in terms of what we can do. Veronica, if you would share with us today, because again, this holiday season is coming and people want to do a lot of things that they simply can't do this year.
I'm in agreement with everyone else. Wash your hands, social distance, don't gather, and then also share reliable information. Information that is coming from CDC. If you read things, flag it if it's not correct. That is some of the mismanagement of COVID-19, is people not buying into science, people not believing what is true. So if you see something that is inaccurate, don't share it, flag it, and just do your part. Do your part.
Do we need to get a flu shot?
Yes, I think we should all get flu shots.
I was wondering about that as it relates to the COVID as well, because someone mentioned earlier, it may have been Dr. Duggins, that that's an important point to bring up as well. So yes, just the whole point of trying to stay safe, right, during this time. So any other comment about that, Veronica? Anything else as it relates to holiday times, getting together, because people just are so used to doing that?
Yes, I know that we had kind of talked about people in my age bracket. Do your part, don't go hang out. Understand that people are supporting you in hospitals, supporting you in family practice, family physician's office, and we want to get home to our families too, and we want to get home safe. A lot of healthcare workers are subsequently getting COVID because we are doing CPR, we're trying to manage our communities, and when you act as an individual, it puts us all at risk. So just be mindful of that, do your part, and we'll continue to do ours.
Thank you, and we certainly do lift you up on the front lines of COVID and trying to make sure that we stay safe and healthy. Thank you so much, Veronica. So glad that you were on the panel tonight. And as we continue to move and talk to other panelists, DJ Fisher, want to get your take. I know you're a sports agent and you fly back and forth to New York. You live in New York, and of course, Wichita is your home. What would you say, in terms of what people need to be mindful of during this holiday season?
Well, I'd probably agree with Veronica and Dr. Duggins, as well as Brandon. I think the key word was sacrifice. I was a doubting DJ, literally. I didn't believe in COVID. I thought it was false. I thought it was pop culture, somebody sharing some other whatever on social media, and plus it hit the news up until, they shut down the East Coast. I'm a somewhat social guy. I wanted to come home. Wichita, Kansas was wide open. You guys were having a great time. I went to downtown Wichita to have a couple drinks and even a cigar. And that moment changed my life. And, I'm almost 40 years old and I come from an older family. My mother is probably one of the youngest of her siblings. And there's 8 of them alive, and they're all over the age of 65. So, I can't see those I want to see and embrace and engage them as I desire, if that makes sense. And I can't really do a lot of things because I'm literally, writing possibly a death certificate by, putting them at risk because elevators or the doorknob, all that can, put them at risk. And not knowing, not being, mindful is scary because we all love our family. And you guys are right here amongst them. I'm across the country. So, obviously the numbers have risen like no other. And, just sacrifice. Trust God and expect all this to be over soon.
Yes, and DJ, I'm curious too, with you working with athletes, what are you telling them?
Wow, just stay out the way. A lot of them, obviously being in sports, their life is surrounded around attention. And when you take attention away from someone who literally lives off of it, it's a huge sacrifice. And as Dee stated, that goes into the mental health aspect of things. And a lot of people, even the government, has considered liquor stores as an essential business. So we got substance abuse and we have suicide going up because of these things. And that even takes it to a whole nother aspect, all because of the pandemic.
Thank you so much. I appreciate your insights tonight, DJ Fisher. Really do appreciate you sharing today. We're going to turn now to Karen Wright. If you would give some comments, Karen, if you would, some remarks about what we need to keep in mind during the holiday season.
You know, Carla, as we were talking about that, and I was listening to some of the other panelists, I thought, well, what can I personally do? Because we can only do so much. But given that I do work with students and given that I do have young family members, one of the things we talk about in my office a lot, and that is, well, what are your goals? What do you want to see happen within the next year, within the next 2 years? Where do you want to see yourself? So I guess I could challenge my students and say, well, rather than get together this Thanksgiving, and rather than think that this is not an issue, let's just say that it is. And so if you want to see your family for Christmas, or if you want to plan some type of get together in the summer, if you want to look forward to something like that, let's take those precautions now and not let's just look at this COVID-19 as if it isn't going to happen. And if you're thinking that, oh, well, we've got O-type blood as African Americans, primarily O-type blood and B-type blood and not the AB, so therefore we can't get it. Let's not look at the situation as that. But let's look at it as, okay, in the next 2 years, in the next 4 years, I want to be at this place and I want to be able to celebrate and spend some time with my older family members. Look at it that way, because it's we don't want it to be such a selfless act. I would just say to my students, I want to just encourage you to think about those in your family that you want them to be here next year and the year after and the year after.
Great advice, Karen Wright. Thank you so much. And Dee,
you're welcome.
You too. Yes. Dee Towns, share your thoughts as a social worker, master social worker, in regard to the holidays coming up and all, celebrating with loved ones only. We have to do it at a distance. My mother turned 80 this year, and we had the drive-by where people would drive by and wave and that kind of thing. You know, it's just a different time now. Any comments? I'd love to hear your comments in regard to
I agree. It is a different time. With that being said, we find people who get pandemic fatigue, and that's, I think, one of the things that is driving these numbers is they're tired of taking the precautions. They're tired of not seeing mom and dad. But kind of like Karen was saying, we have to look at the bigger picture. We have to be forward thinking. We sacrifice Thanksgiving, maybe Christmas, so that we can have a beautiful Easter or 4th of July, so that, you know, loved ones can gather. One of the things that we are seeing a lot in mental health is we do have families that are losing loved ones, and we have a struggle with funerals and celebrations and things of that nature, and being able to say, yes, you want to celebrate this person's life, but we have to do it without risking everyone else. And I think that's a big thing that our young people and even people my age are neglecting, is that risk factor. Yes, you are healthy. Yes, you feel great, but you can be a carrier. You can take that to these funerals. You can take that to these birthday parties and just not even know it. I've had friends who'd had a dinner party, 12 family members sick, just like that. It's very dangerous. And we have to recognize, yes, we're tired. Yes, we're over it. I have said myself, I am over it after having stressful sessions and not knowing how to help an elderly person or a young person to understand it. I can understand it because I've seen it from different perspectives. I've talked to young people. I've talked to the kids that are in the best times of their lives. They're 21, they're 22. They want to go out with their friends. They want to celebrate the things that we did. You know, I was there. I tell my kids all the time, I was there. I like to party and stuff, but it's not worth the risk on the other end. So we just have to look at the back end. And that's hard to do in this instant gratification world that we live in. If I can get it right now, it's hard for me to say, let me wait. So one thing that we have to do is be neighborly, be kind, and be cognizant of the other person, not so much you, but your neighbor, your friend's grandparent, your friend who just had a baby. Be cognizant of those people and be a good steward. Wear your mask, wash your hands, stay at home.
That is wonderful insight. Thank you so much, Dee. We appreciate your comments, Dee Towns. And at this time, we're going to watch another video, and we want to remind you in Wichita, the Fact Not Fear campaign has been in full swing, utilizing social media, radio spots, TV commercials, yard signs, etc., to encourage the Black community to take COVID seriously and take all the precautions. Here's an example of what we are doing in Wichita and introduces the Facts Not Fear television commercial.
It's a fact. African Americans have higher costs, hospitalizations, and deaths from COVID-19.
Come on, people, be smart. Avoid large crowds, wash your hands frequently, and mask up.
Going to crowded bars right now, it is dangerous for you and the people that you love the most.
Be patient. Those days will come back if we take extra caution for a few extra months. We've got this.
Keep the holidays safe for every generation of your family. Protect them and protect yourself. Mask up.
Thank you so much for sharing that commercial. It's wonderful to see local folks talking about the importance of this disease and what we need to do during this time. And we certainly want to thank our panel who have been just amazing tonight. We certainly do appreciate that, the comments that have been shared this evening. And we want to thank Dr. Maurice Duggins from Family Medicine. He's a family medicine physician. Ascension Villacristy. Also, Veronica Henderson, thank you so much for participating. And of course, she's involved as a psychiatric mental health nurse at Wesley Medical Center. We want to thank Brandon Johnson, Wichita City Councilman, District 1. Thank you so much to Karen L. Wright, who's the Assistant Director, Academic Advisor, TRIO Student Support Services at Wichita State University. Also to you, Dee Towns, Licensed Master Social Worker, and DJ Fisher, thank you, National Award-winning business magnet and sports agent. Thank you so much for all of you coming on and sharing such great information. We also want to thank Roland Martin Unfiltered for streaming this live on their platforms so the rest of the nation can see it. We want to let you know that there is another town hall discussion coming up. The second one will be about young people and COVID. That'll be on Wednesday, December the 16th. And we do want to say thank you once again to all our panel and our panelists. And I'm Carla Echols from KMUW. Thank you so much for joining us. Be safe. Happy Thanksgiving. Good night.